Now let's talk about biohazard labels. Biohazard labels are utilized to identify bloodborne pathogens and potentially infectious materials in containers and packages. Labels should be affixed on the biohazard container by adhesive, string, wire, or other method that prevents the label loss or unintentional removal. Containers must have a biohazard label prior to storage, shipment, or transport. Biohazard labels shall be completed like the example shown here. Identify the name of the infectious agent or bloodborne pathogen. List the name and telephone number of the supervisor generating the infectious waste. Record the building and/or room number where the waste was generated. Be bright orange or orange-red with lettering or symbols in a contrasting color such as black. Equipment that may be contaminated with bloodborne pathogens must be examined prior to shipping or servicing and shall be decontaminated if necessary and feasible. If not feasible, a readily observable label in accordance with Washington Administrative Code must be present and the servicing vendor must be alerted to the contamination. Examples of contaminated equipment can include items such as laboratory instruments and other items contaminated unintentionally during injury or illness. Training must be completed annually by any employee that may be involved in spill cleanup or has the potential for other occupational exposure. This training will be assigned to you annually through Lower Columbia College's Canvas software system. Please be sure to complete this training in a timely manner when you are invited to do so. If you have any questions, please post them in the discussion section of this Canvas training or email message the course instructor. Departmental personnel and job classifications that have been determined to have a risk for occupational exposure and other departmental personnel at the discretion of their supervisor will be offered a hepatitis B vaccination series. Immunization from this vaccine is considered valid for at least 15 years, possibly a lifetime. Those completing the series shall have their hepatitis B immunity tested 1 to 2 months after completing the series to determine if the vaccine was effective. When an employee has documented exposure to a bloodborne pathogen, they may be titer tested for immunity to hepatitis B within 48 hours of the incident, if they request. Failure of the titer test allows the exposed individual to repeat the vaccination series. The hepatitis B virus is a viral infection with a major effect on the liver, and the vaccine series includes a total of 3 injections over a period of 6 months. Risk and possible side effects can include tenderness in the injection site for a few days, fever, chills, headaches, muscular aches, and/or a rash within the first 48 hours. Although no serious adverse reactions attributable to the hepatitis B vaccine were reported during the course of clinical trials, there's always the possibility that a broader use of the vaccine could reveal adverse reactions not observed in the clinical testing. As with the administration of any vaccine, there's a possibility of more severe effects. Children, pregnant women, nursing mothers, and persons with severe heart or lung problems should not receive the vaccination series unless they are following specific physician's advice. People with fever should not receive this vaccine, and people who have received another type of vaccine within the past 14 days should see a physician before taking this vaccine. Now let's talk about what you should do if you believe you have been exposed to a bloodborne pathogen. An exposure incident is defined as a specific eye, mouth, or other mucous membrane or non-intact skin contact with blood or other potentially infectious materials that results from the performance of an employee's job duties. Examples of exposure incidents include a needle stick with a contaminated needle, a cut by a contaminated instrument or glass, or a splash to the eye, etc. Once you have reported your injury, a confidential post-exposure evaluation and follow-up, including the necessary prophylaxis and laboratory tests, will be provided to you at no cost. Employees need to go to a healthcare provider and follow up as soon as possible within 24 hours. Be sure to follow these steps if you are injured. Discontinue procedures immediately, wash exposed area, and provide first aid. Initiate bodily fluid cleanup procedures. Obtain the source's name and contact information. Convey the need to confirm the source's HIV, HVC, and HIV status, or a need for a blood test to determine their status. Report to a healthcare provider within 24 hours, and initiate an accident report at LCC within 24 hours of the incident. Make sure you provide your healthcare provider with the following: a copy of Washington Administrative Code 296-823-160, a description of the exposed employee's job duties during the exposure, documentation of the routes of exposure and the circumstances surrounding the incident, results of the source's blood testing, if available, and all medical records relevant to the appropriate treatment of the employee. Bloodborne pathogen exposure shall be reported on the LCC accident report form. It should be indicated on the report that an exposure to a bloodborne pathogen may have occurred. The following information shall be included when filling out the accident report: the department or work area where the exposure incident occurred, an explanation of how the incident occurred, engineering controls in use at the time, a description of the device in use at the time, personal protective equipment and/or clothing in use at the time, the location of the injury, a procedure being performed when the incident occurred, the employee's training, recommendations for avoiding such exposure incidents in the future, and a copy of this report needs to be kept on file in the department and routed to the Human Resources Department. LCC is required to maintain a SHARPS injury record for 5 years. This is accomplished by reporting contaminated SHARPS injuries to Human Resources on a completed accident report form. Human Resources then lists the SHARPS injuries on the OSHA 300 log. A copy of this log is located on the bulletin board in Human Resources and also in the staff room in the Student Center. LCC is committed to establishing and maintaining confidential medical records for employees with risk of occupational exposure. Each year, LCC will review and amend, where necessary, the campus bloodborne pathogen prevention plan to ensure best practices are effective and maintained. Now let's talk about biohazard waste. Regulated biohazardous waste is generally defined as any waste that can cause an infectious disease or that is reasonably suspected of harboring human pathogenic organisms. It is also known as medical waste, red bag waste, infectious waste, potentially infectious waste, and biomedical waste. Biohazardous waste requires special handling and is regulated by the state of Washington. Biohazardous waste is not to be placed in the regular trash stream. Departments that generate biohazardous waste must segregate that waste and work closely with custodial staff and security personnel to ensure correct disposal. The transportation and disposal vendor that handles biohazardous waste shipped from LCC must be informed of the identity of any biological agent present in the waste, which may present a health threat to them or the environment. This is accomplished by correctly labeling all containers with the required information. These transportation and disposal vendors must also be informed when the biohazardous material presents a threat to the health of wild or domestic animals in the case of accidental release during shipment or disposal. When disposing of broken glass, be sure to use a designated and labeled container. Be sure the container weight does not exceed 40 pounds. Be sure the container is puncture resistant and will hold up during transport. Non-contaminated glass should be disposed of through campus services. Custodians are not required to dispose of glass which is not placed in containers approved by campus services. Campus service personnel do not need to handle glass waste collected in containers weighing over 40 pounds or that could rupture during handling. Label containers "Caution, glass waste," include the building and room number, line the container with a heavy-duty plastic liner, and when full, close the bag and secure with a twist tie. Tape the lid to ensure it is secure, and call campus services for disposal. Contaminated glass refers to glass which is contaminated by radiation, acutely hazardous chemicals, or biologically hazardous material. Do not put contaminated glass in regular trash receptacles. Special handling is required. The generating department is responsible for the proper handling and disposal of contaminated waste. Custodians should not handle contaminated waste. Contact the Environmental Health and Safety Manager with any questions. When contaminated sharps are improperly disposed of in trash receptacles, it presents a potential for exposure to bloodborne pathogens and other infections. When handling trash, be sure to wear utility or leather gloves. Look into the receptacle for the presence of sharps before handling. If sharps are noted, leave the trash in place and notify security. Avoid reaching into a bag or receptacle to push down or compact trash. Do not transport a trash bag with questionable integrity without double bagging and placing in a rigid container. Close and tie trash bags shut before removing them from the receptacle. Look at the bag as it's pulled from the container for the presence of sharps sticking out of the bag. If sharps are noted, place the bag back into the receptacle and notify security. Do not throw improperly discarded sharps into the trash compactor. Using the correct technique to wash hands is imperative to ensure proper decontamination. The steps of proper hand washing are explained in LCC's Bloodborne Pathogen Prevention Plan.